It's time now for County-Wide, a special presentation of Yavapai Broadcasting News. Join Paul David and Brad Miller as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives here in Yavapai County. And now, here's today's County-Wide.
Well, good day and welcome to the program. It is County-Wide. Brad Miller with you, and we're happy to welcome back into studio today from the Yavapai County Community Health Services Department. David McAtee is here. We're talking flu today. Hi, David.
Hey, thanks.
This is, very, very timely. As we've been kind of following the news nationally, just in the last few days, really just this week, there's been a lot of headlines and a lot of talk about the flu. It's here, certainly, kind of moving from the east to the west, generally speaking. Yeah. Some 41 states now, according to CNN, have widespread influenza. 18 child deaths due to flu so far this season. That's nationally. Thousands of people, a good percentage of the city of Boston's employees have been staying home because of the flu, and so on and so forth. So the flu is really here this season, and I want to talk to you about any number of things. But is there, to kind of start us off, does these numbers and that we're kind of really talking about it here suggest that this flu is worse this year? Does that just mean it's more widespread, or that it's I don't even know how this works, a harder or more difficult strain? What's going on?
I think the biggest concern right now is that it started so early. The flu season starts in October and can typically go till February. And really in the January, February months are when we see our biggest numbers. We started seeing flu numbers back in December, and it's just gone straight up from there. So the fear is that it just started so early and that the numbers could get much bigger. Is the flu shot that we're giving out, is it effective? Yes. They do feel that the 3 strands that they've put in the flu shot are the ones that they're seeing out there. We just need to get people to get the flu shot, so it's effective.
Now, when we see this, and it's kind of some eye-popping numbers that grab your attention, some fatalities even, a lot of people, does that mean that it's just because it's, as you said, started early, that more people are simply unprotected? You know what I'm trying to get at? Is this the big monster flu that we're all afraid of, or is it the same as any other flu? It just is moving faster.
It's the same as any other flu. Okay. This isn't the 2009 H1N1, where we're going to see 10,000, people with flu. It's just because it's starting so early, and a lot of people kind of wait until January, February to get their flu shot, and that by that point it's too late. Okay. It takes about 2 weeks for your flu shot to take effect, for your body to build those antibodies, and at that point, maybe you've already got it. So we really recommend people get the flu shot as soon as it's available, which is back in November, December, and just get prepared. But no, it's not pandemic levels or anything.
Oh, okay. And I wonder if people get excited about it, that's it, that it's, well, even a flu shot's not going to help, and these kinds of things. You start to hear that, and we don't want panic.
Right. No, we don't want panic, and just keep in mind that the flu shot does work most of the time, and again, you've got to take that 2 weeks before you get sick, and a lot of people say, well, I got the flu shot and then I got sick. Well, it wasn't because of the flu shot. It was probably because you didn't get it early enough, or you got something after you got the flu shot. So
let's talk about Yavapai County then and the flu shots. We've got the vaccine. It's available now.
It is. You can get it at any of the community health centers in Cottonwood, as well as Prescott and Prescott Valley. Most of the pharmacists are giving out flu shots at this point. Yeah. A lot of grocery stores are giving a discount. We don't care where you get it, just make sure you get your flu shot. Sure. But it's available from 6 months old, children 6 months old on up. And really we recommend that the younger children and the older people get the flu shot first. We really want to make sure that those people who are more susceptible to the flu, and like you said, there were already 18 deaths, pediatric deaths this year. So really, get your flu shot.
We don't want that. The little ones and the older ones just don't have the same kind of fighting ability. Right. Internal fighting ability.
Right. Their immune systems just aren't either fully developed, or as you get older, your immune system starts to fade. Right. And even people in the middle of them who may be sick already, your immune system's already fighting something, and now it's got to fight something else. Right. Where you could have gotten the flu shot to build up those immunities. And
I guess in the way that a flu shot will kind of insulate your body from what's trying to attack it. Right. With the babies, let's say, under 6 months who aren't eligible for the shot, you want to kind of literally insulate them from other, taking them out where it's public and all that is, you probably want to keep the little ones home.
Absolutely, yeah, and keep them away from the uncle that wants to hug and kiss and then cough and we call it cocooning, where everybody around the baby has had a flu shot.
Okay.
So there's that method, which is always a good idea. But yeah, just keep your babies that are that can't have the flu shot away from those people that are sick, and
just all those good ideas.
Yeah.
Other preventative measures: wash your hands. I should tattoo that on my forehead with my boys at home.
Yes.
I think that people don't understand how effective that can be in fighting this and other problems, not just the flu.
Right, and really washing your hands is just the beginning, and make sure you do it right. It's that 20 seconds with soap, warm water, paper towel. Take the time to wash your hands, but also take those Clorox bleach wipes and wipe down the handles, the doorknobs, like you said, your game controllers, anything that your kids are going to touch. You need to wipe those down with the antibacterial type wipes. But yeah, wash your hands. That's how you get it. You get it on your hands, and then you rub your eyes. You scratch your nose, whatever, and that's how you're getting it. Is it's got to get into you somehow. So it's got to come from your hands. So wash your hands.
I read a statistics. I don't even know where it was. It had nothing to do necessarily with the flu, but it said the average human, when sitting at their computer desk at work, say, or what have you, watching TV at home, will touch their face. It was something like once every 17 seconds.
Yeah.
That's just the average of whatever. You just fidget, whatever.
You don't
like
think
that.
about it.
And it's like, holy cow, how do any of us survive the day, with that kind of constant,
And this is how the viruses get into your body, through your eyes, through your nose, through your mouth. So, when you're eating, you've got that potential to, bring in those contaminations. So wash your hands.
A lot of common sense goes into
absolutely.
it. Listen to mom. Wash your hands. Not just before you eat, but really, should you just, several times a day, just go wash your hands? Or
it's always a good idea to stick with the basics. Wash your hands before you eat. That's kind of the critical one. But yeah, absolutely. Whenever you go to the bathroom, please make sure you wash your hands when you go to the bathroom. I know we mandate that within our restaurants. If you're cooking, we make sure that you wash your hands and that there's soap and that there's a sink available. But in your home and my home, we need to do the same thing. We need to wash our hands before we cook, before we eat, and like I said, wipe stuff down.
Just good common sense.
Yeah.
When we talk about the flu, it's a wintertime thing. And as I understand it, it really doesn't have to do with that it's cold outside. You don't catch the flu out in the open chill necessarily, but that can make your body more susceptible to getting the flu. And mostly the flu is spread because, not quite so much in Arizona, but back in the Midwest where it's very, very cold, say, everybody's inside all the time.
Right, and that's why we see the flu start back east, honestly, and it kind of moves across the country because they get that cold weather so early on. They're inside all day for the most part, and they're cooped up, and they're not, washing their hands, and there's just that cross-contamination of, you talking to me, and now I've got it, and I talk to someone else, and they've got it, and so, yeah, it's because we're all inside and can't get away from each other in essence.
If we all stayed inside during the summer, flu season would probably come. And it can. I think we can catch the flu any time.
Yes.
Typically the winter is when everybody else has it and when we're all more likely to get it. Let's go ahead and take a little break. When we come back, I don't know if we have any kind of final thoughts on the flu. I guess the flu shots are available. Mm-hmm. That's maybe one of the biggest things to say. The simple things, wash your hands and all of those kinds of things will try to help prevent it. Don't panic.
Right.
Is a key.
Yes.
We've got a case of rabies, or did very recently, in Yavapai County. We'll talk a little bit about that when we come back. Again, our guest is David McAtee, Yavapai County Community Health Services. We're back to Countywide right after this.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket. And it's always in the same place. And then she acts so surprised when I find them. But, she's putting them in the same basket. Again. It's like, hello? That's where you put it last time. You were the worst at hide and go seek.
I was in junior high the first time I caught my mom using denial. She had to have known her painkillers were missing because I kept stealing them. Her denial was so out of hand.
So she doesn't even know? I'm going out.
It was like I could get away with anything.
You kids have fun.
And that was when I knew. When she was addicted to denial.
Denial is a drug. Get help. The partnership at drugfree.org.
So, same time next week?
Well, of course. Put away a few bucks, feel like $1 million. For free tips to help you save, go to Feed the Pig.
Now, some action from the courts. Billie Jean King renewing her rivalry with Arthritis. First set, furious volley, and right to the net for a winner. Beautiful forehand there. Arthritis, stunned. And here, match point. Billie Jean with the ace, taking it in straight sets. Afterwards, a jubilant Billie Jean King.
Tennis is a weapon for me with arthritis. There's nothing like it for me to hit a ball, run to the ball, anytime, any court. I'm ready. Let's go.
What's your weapon against arthritis? Find out at fightarthritispain.org.
Welcome back to the program. It's Countywide. David McAtee, Yavapai County Health Department is here today. And so far talking about flu shots. We'll visit rabies in a moment. We have a case, had a case recently in Yavapai County. A young child was attacked or bitten, had contact with a rabid fox. And we'll talk about that in a moment. Just a couple final words on the flu. There's some folks who are concerned about the flu shot itself, that the shot will make me sick, or, well, I don't like shots. Right. Or those kinds of concerns. How does the flu shot work, and is there a legitimate health fear that I might have just from the shot itself?
Okay, well, the way it works is basically there's a group of people that get together every year and decide which 3 strands of flu that are going to go into the immunization or the shot. And so then they start producing that, and it's a dead virus. It's so that it goes into your body. And the number one complaint, obviously, when people get a shot is pain. There's a little soreness in the arm. Yeah. Some people, as you and I were talking earlier, will feel a little sluggish, and that's just basically your body reacting to this virus that's been put into your body, and it's calling out the white blood cells, and it's going after it, and it's building these antigens that then it will use to fight the flu shot later on. Are there risks? Sure, there's risks in anything, but we really feel that the benefit dramatically outweighs the risk. Yeah. And really, what the risk you're talking about is the soreness. You might feel a little sick. For the most part, that's really all people see. So. Okay. And some people can't take it because it's made with eggs, and some people are allergic to eggs. Okay. They're working on alternatives to that. A lot of people don't like some of the preservatives, so they've taken that out of the kids' flu shots. Some people don't like shots, so they get the little nasal swab. So there's all kinds of options. Just call and find out. Yeah, the flu's no fooling this year, and you want to protect yourself as best you can. Yeah. All right, let's talk rabies. Last week we had a story. Your department said something about it. Game and Fish said something about it. Very quickly, a child, a minor age child over near Sedona on Elmerville Road, kind of south of the city, was attacked, I guess is the word we'll use, but had contact with what turned out to be a rabid fox. The child has now undergone or will soon undergo the whatever needs to be done. I'm going to ask you about that too, how that works once you do get rabies. But that's a little cause for concern. Rabies, I think about like in warmer temperatures and different times of the year. So is this unusual? This is very unusual. We were the very first of 2013 to report a positive rabies case, which is nothing to be proud of, unfortunately. Yeah. Like you said, it did happen in the Sedona area, and it was a couple of kids who saw it. One of them went to protect the other one and was bitten, scratched. So it wasn't that bad. But of course, when that happens, the parents called Arizona Game and Fish. Arizona Game and Fish came out, captured the animal, and had it sent down to Phoenix for testing. It came back the next day positive for rabies. So at that point, the parents, and I believe even before the test came back positive, the parents had contacted the doctors, the hospital, and had the child set up for this the process of fighting rabies. And it's not as bad as it used to be, but it's still unpleasant.
It used to, can I talk to you about that? It used to be like a series of shots in the stomach over a course of, I think, quite a few days, actually.
Yeah, and now it's pretty much all done at once. They give you one shot around where the actual bite was, and that's just to fight any kind of infection.
Sure.
And then they give you about 5 other shots, typically 2 in each cheek and then 1 in the arm.
Wow.
So you get through it pretty quick. It's not enjoyable, but it's
better than rabies.
Right, exactly. Yeah.
Now, can rabies, if untreated, if say, some farmer had a contact like this and was untreated, was going to tough it out, can human beings fight off rabies, or is it fatal in humans like it is?
Most cases, it's fatal.
Is that right?
Yeah. There was a story last summer about a girl who got bit by a bat, and they didn't know that it was rabies, and she survived, but it was dramatic, and she's still going through physical therapy because it basically just attacks your nervous system, and it's most of the time it's fatal. So don't mess around with it.
I know in animals, I've had game and fish tell me it's 100% fatal if a fox, whatever, gets it, they're a goner.
Right.
And it's not pleasant.
No.
It is just not a very nice kind of thing to have, unfortunately. So does this suggest now, along with this story came, I guess, a sighting or concern that there was at least one other fox in this same general area displaying symptoms that would suggest it too was rabid?
Yeah.
Where are we on that?
I don't think they ever found that specific fox. I believe when the Arizona Game and Fish official was out there, he saw another fox acting aggressively, wasn't able to catch it. Since then, we've had a couple of hikers take pictures of dead foxes in the same area, and they didn't show any sign of trauma. So we're kind of guessing that was also rabies. And I believe Arizona Game and Fish went out and is collecting them or has collected them. And we're working with them. The Yavapai County Community Health Services, as well as Arizona Game and Fish, is working to determine whether or not we need to put up signs. Because if this is bad enough, because there's never just one rabies case. It's usually a couple, at least. And so we want to make sure people down in that area, because there's a lot of hiking that goes on in that area.
Oh, it's a beautiful spot.
Yeah, and now with our weather still being nice, people are doing hiking, and so we're looking at whether or not we need to put some signs down there, just let people know.
The foxes that folks photographed that were already dead, it sounds like they died from the disease itself, from rabies itself.
That's what we're guessing.
Oh, can they still be, we don't know when they died, do they have to be, not to be gruesome, but freshly dead to test, or can they be tested anytime after?
They can be tested up to a couple of weeks, basically, and their bodies just start to decay. And these didn't look like they were decaying, so they looked like they were, the photos that I saw looked like they were pretty fresh. So they'll probably collect them.
I know, like, we did a show one time talk about plague and the dangers that can pose, plagued animals. And if you were to go up to one that was long deceased for whatever cause, that can be very, very serious. Yet, how about rabies? If you mess around with a dead animal and it turns out it died of rabies, can you contact rabies that way?
Yeah, you can actually.
Oh, really?
That's one of the things that we really warn people to do. When you see a dead animal, don't pick it up, don't touch it, obviously. And that goes for, we see it in bats, skunks, javelina, foxes. So, if you see a dead animal, don't touch it. And one of the things that people don't really think about is if you're camping and you wake up in the next morning and there's a bat in your cabin, that bat may have cut you and may have transmitted rabies at that point.
During the night.
During the night, and you won't even know it. So yeah, not a pleasant thought.
Well, now let's in a scenario like that, do I try to catch the bat?
Yeah, really what we recommend you do is call the Arizona Game and Fish if you've got any real concerns. I mean, and because when you try to catch it, then you're opening yourself up to even more potential risk. But yeah,
it's how the test is done.
Yeah.
We can apply that same question to this incident in Sedona where the youngster had contact with the rabid fox. If that fox had gotten away and hadn't been caught, tested, and shown to be positive, would that child have gone? Is there a test you can do to show rabies, or would the child simply have had to go through the course of treatment?
They would typically just give the child the treatment.
Just to be safe.
Yeah, just to be safe. And a lot of times if you can't, quarantine the animal and watch it, then they just give the treatment to the child because it's just not worth the risk.
Okay. We need to take a break, David. We'll do that. We'll come back with some more on rabies, kind of an unusual and rare case, certainly for this time of year in the Sedona area. A little bit more from David McAtee. We'll be back right after this.
Having a fire escape plan is very important to keep your family safe and together in the event of a fire. When you awake to the sound of a smoke detector and smoke in your room, don't stand straight up. Carefully roll off your bed and stay low under the smoke. If your door is shut, feel the door with the back of your hand. Slowly open the door if no heat is felt. Always stay low until you get to the outside of your home. Always have 2 ways out of your house and a specified meeting place somewhere outside your home. Home escape plans should be drawn up and rehearsed on a regular basis. This could be the difference between life and death if caught in a fire.
Yes, ready? Go get it.
Oh, come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
Fire can happen at any time. What would you try to save?
My family photos.
My grandfather's war memorabilia.
My dogs.
I'm firefighter Brandon Wacker with the Cotton Fire Department. A working smoke detector is your best defense in the event of a fire. Make sure you have a smoke detector in every room except your kitchen. Test them monthly and change the battery once a year. Take the time to save the things you can't replace.
Hello everybody, I am Lou Ann Patterson. My family and I would like to welcome you to the Copper Star Indoor Shooting Range, Northern Arizona's premier shooting sports facility. We offer a 25-yard pistol range, a 50-yard archery range, and Arizona's only 100-yard indoor rifle range. In addition, we have a full-line gun shop as well as an archery pro shop. Come check us out. We're located at Highway 260 and Cherry Road, right next to Out of Africa. Looking forward to seeing you all.
Welcome back. Our final piece of County-Wide today. David McAtee, Yavapai County Community Health Services, and talking flu early on. Get your flu shots. It's not too late. There's plenty of the flu out there this year. Kind of a bad season for that it's out, really kind of spreading across the country. And then rabies case in Sedona, young person being treated for having contact with what turned out to be a rabid fox. Pets. A lot of times there's encounters. That's how rabies gets into the family.
Right.
We can immunize our pets ahead of time.
Yeah, you can make sure your animals are get the rabies shots. Keep them on a leash if you're going to take them for a walk. But yeah, the rabies shots are really the best thing.
A lot of times that's where we'll hear about rabies is pets that become infected because they have contact with coyote, what have you.
Right.
When this animal, I don't know how these kids reacted. If it was, I know sometimes they'll act aggressive, and other times they'll act very passive. And I don't know the story. It also won't pretend to, but it just seems like if there were two kids, they may become curious when they saw a fox, which is pretty.
Right.
A lot of times, maybe not running away from them as you might expect. I don't know what happened.
No, we don't.
So we won't speculate. But somehow there was contact. So if you see an animal acting, quote unquote, funny,
well, and it's a great opportunity to talk to your kids about the fact that if you see a wild animal or even a domesticated dog that you don't know, it's not a good idea to walk up to it and start petting it, because you don't know what that animal is going to do.
Yeah.
And it could have rabies. So
again, just the common sense approach.
Yeah.
All right, David, in our final few seconds here, you want to mention the clinic?
Yeah.
Please do.
I want to make sure everybody knows that in Cottonwood, right around 51 Brian Mickelson Parkway, right by the community health center, the rec center and the library, there is a doctor's office, and we take those with insurance, without insurance, and it's a great place to go. So if you need a doctor,
can I get my flu shot?
You can get your flu shot.
Okay, there we go.
The best way to find us is go to the website chcy.info.
Okay.
And they'll you can see everything that we do and see some pictures of the place, and it's nice.
Lots of information. Look online, find out, protect your health, get your flu shot if you haven't yet. Stay away from the rabid foxes, certainly, and other animals that might be acting a little funny, a little rabies, especially in the Sedona area just recently. David, we thank you very much for coming in.
Thanks for having me.
Sharing your knowledge and insights with us from Yavapai County Community Health Services. David McAtee, it's County-Wide, and we'll see you next time.
This has been County-Wide, a special presentation of Yavapai Broadcasting News. Listen in each Tuesday and Thursday as we tackle the hot topics and talk to the decision makers across Yavapai County. That's County-Wide with Brad Miller and Paul David each Tuesday and Thursday on this Yavapai Broadcasting station.